6 minutes after 7, you're still watching the AM show on Joy News on Multi TV. Let me just pick a few of your comments, then we move on with the show. This one says, help me give advice to modern ladies. The beauty of a woman can take her to a palace, but her character determines how long she will stay in the palace. Beauty attracts men, but character keeps them. Exposing your body to the public will never earn you a husband. It will only earn you a friend. And this is from Bamba Kai Samed in Fumbisi. Okay, I'm sure you're still fasting. So all the best to you. This is from Dr. Abedi in Kwada. So you're saying that you think the ECG and the PURC are still not aware that they're not in the good books of majority of Ghanaians. Who cares about their politically instigated strikes? That's what he says. He says they should rather choose to resign after the 7 days. We are tired of them. How can we suffer in our own country? He also says hi to Mr. Ishmael of Mockup Microfinance, the Empajo of Big Shoes near Kwada, so Onion Market, and Iceman of Kwada. So okay, and then this one says, when is the government going to pay teachers? They have taught for many years without pay and are suffering in their various communities. You didn't add your name and location. Please remember to add your name and location. Just a few more of your comments. This one says, hi, good morning. Ghanaians should not blame ECG for the high tariffs. President Mahama and the PURC are to blame for imposing more taxes on poor Ghanaians. Well, and this is from Sule in Sunyane, and you're saying that you'd wish that a lot of Ghanaians would make a different decision this time around. Well, it's up to Ghanaians to choose for themselves. But now let's move on to what we have at this time in the show. Caritas Ghana is a charity organization of the Ghana Catholic Bishops' Conference and member of the Global Caritas Confederation. It operates under the National Catholic Secretariat. Samuel Zan Akologo, he likes to be called Zan, is Executive Secretary for Caritas Ghana. And well, they work on public policy advocacy on behalf of the poor, and the promotion of the common good is central to Caritas Ghana. One example is its efforts to include the right to health in the National Constitution Review. Okay, thanks for joining us, Zan.
Thank you.
How are you?
Bernice, I'm good, and you?
I'm doing well.
Fantastic.
Public advocacy must be a really difficult thing to do in this part of the world. Is it?
Yeah, to some extent, yes, but just a little correction. We're talking about public policy advocacy. In other words, public policy relates to, legislations, also about what government decides to do or not to do, all for the promotion of the well-being of citizens. So that's it. And back to your question, whether it's difficult, of course, in some sense, you will say that Ghana has come a long way in the consolidation of our democratic gains. So in that respect, in constitutional rule, is in principle, it's supposed to be a lot easier to do public policy advocacy. And for those of us who come back from a long time ago in this field, in the 80s, it was more difficult. So we can say now we've made some inroads. But there are still some bottlenecks, which makes it difficult. And this has to do with sometimes access to information. As you know, the right to information bill is still not there. That also relates to the opacity in public policy making, and sometimes, there are no clear procedures for feedback to citizens, and, you only come across a certain policy disposition at a very late stage, maybe when it is being considered at cabinet level.
And then it's
so
difficult
all of this is difficult. Sometimes even in parliament, who are supposed to be the lawmakers, they only get to know about the policy when it's presented to them to make a decision. So all of this creates some difficulties. And the last one has to do with our information management system. Data is a big weakness in developing countries. And without data, decision-making becomes difficult.
So apart from the right to health, which you fought for or you contributed in the constitutional review, what are some of the other public policies you've advocated for?
Okay. Yes, we participated proactively in the constitution review process, and basically we were pushing through a number of key issues that were mandated by our employers, that is the Ghana Catholic Bishops' Conference. For the constitution review, their issues were the right to health, the abolition of the death penalty. They were also interested in the entrenchment of a long-term development plan in the Constitution. So we worked around all those issues. For the death penalty, we worked in collaboration with Amnesty International. We've done a lot of work pushing for the long-term national development plan. Thank God it's in process now. The right to health basically emanated from a research we did on the implementation of the Public Health Act, just to see how that was being rolled out, and so that became the basis for our further advocacy work.
All right. So, how big is Caritas Ghana? Do you have, are you decentralized? Do you have representatives in parts of the country where you can, understand what's going on in each community and be able to, advocate for certain policies that really affect people in some parts of the country where we can't really reach them from the capital?
I should say something very quickly. Actually, if you like, Caritas Ghana is not new. It is only new in the sense that in recent time, the Bishops' Conference made the decision to formalize its existence. That meant that they wanted to register the trademark, and this is a request from the Global Caritas Confederation to make sure that it is protected and has legitimacy in different territorial jurisdictions. So that's what the Bishops' Conference did. Otherwise, what is called Caritas now is basically the socio-economic development wing of the Catholic Church. To use church language, that is what they call socio-pastoral work of the Catholic Church. So in that sense, it doesn't change what we used to do. So the church's work, services in education, health, promotion of livelihoods, promotion of incomes of rural people, all of that is the church's Caritas work. So in that sense, it is not just our work in public policy advocacy, but also complementary service delivery by the church, and that is attested to by the public. The church has done a lot of work in providing services, especially in very rural and deprived areas.
Okay, so but let me just come quickly with this. In public policy advocacy, there's lobbying, there's litigation, and there's public education as well. What is the biggest project you've worked on, or biggest project you're planning to work in terms of public education?
Okay. Yes, indeed. For this year, there are a number of issues. We have plans to promote the new Sustainable Development Goals that have just been, that were adopted last year, and that becomes the framework for international development benchmarking as well as national. And talking about SDGs, that also relates to Africa Agenda 2063. We think that it's, yes, decisions have been made, but now the onus lies on implementation. So we're trying to see how we can promote that. Hopefully, we will be doing a quick assessment of Ghana's preparedness in terms of implementation of the SDGs, but also to promote its awareness. Our bishops are concerned about an emerging trend of land grab, which is the appropriation of large tracts of land by individuals or companies, sometimes displacing people, rural people, from their livelihoods, and we will be looking at some of these issues. We have some ongoing work in areas of the education, the reforms in education, especially relating to the new Education Act. We are interested to see how that rolls out, and ensuring that the historical antecedents of faith-based involvement in education is not missed out. I had the opportunity to make that strong point yesterday. And I was very happy that the response was, yes, there is space. I mean, there is no deliberate intention to deny the role of religious groups in the area of education. And there are prospects also through the legislative instrument to make sure that this is more elaborately defined. So we will be taking up some of these issues. We're still interested in the issue of the Public Health Act because our last research clearly showed that this is one groundbreaking innovation to promote public health as opposed to clinical health. And yet, information about it, especially out there, is still quite lacking. We want to see how we can promote that.
But in all of this, what are the specifics? How do you intend to do it? Do you do community-based outreaches? Do you print letters, newsletters? Do you print out magazines? What is the strategy in public education for Caritas?
Okay. That's helpful. Maybe I should just let you know, one of the greatest strengths is our outreach. So Caritas Ghana is not just the national structure. For example, all the 20 dioceses, a diocese is the geographical entity under the administration of a bishop, and so all of those structures, so it means it's even more decentralized than 10 political regions. So all of those units have development wings, and therefore that's the Caritas unit. So we will be working with these diocesan development offices. We also have various Catholic social action groups who are involved in these issues, like the Justice and Peace Commission. We'll be working with Catholic lay action groups like the Catholic Media Associations and others. But of course, we also produce documentation. Those action research that I mentioned in the area of land grab SDGs, the result of it will be published papers that we will disseminate through policy briefs and make sure that it gets out there. We have a newsletter that we publish, is the abbreviation is C2 Agenda for Change.
C2 Agenda for Change,
which basically means Catholic Community Agenda for Change, and that is focusing on policy, education, etc.
So lastly, what's the desire of Caritas Ghana in all of your public policy advocacy? What's the dream? What's the ideal thing you hope to see for the nation Ghana?
Clearly that the poor and the deprived and the marginalized in community get recognized and get attention in development policy. And this resonates very well with the 2016 review of the implementation of the Sustainable Development Goals, which is leaving no one behind. So we really want to make sure that we can use our outreach, we can use our option for the poor to make sure that the poor is at the center of policy consideration, policy making, and policy implementation through programs. And that's why at the launch, we actually threw out a challenge to government that we would be willing, for instance, to participate in the implementation of Ghana social inclusion policies, and especially the safety nets.
All right, thank you very much. You just heard Zan Akologo. He's Executive Secretary for Caritas Ghana, and they work on public policy advocacy on behalf of the poor. He loves to be called Zan. Thank you so much for your time. When we come back, we'll be talking about decentralization in education. Before you go, Zan, what's your take on that?
Sure. We support education decentralization. It's one of the principles of Catholic work subsidiarity. Decisions should be taken as close as possible to the people. All we want to see is specific to education, make sure that the role of religious bodies is recognized in all of this.
Thank you so much, Zan. It's been a real pleasure speaking
Thank you very much.
to you. So we'll take a quick break. When we come back, Kwabena Tenchehine will join us. Please stay on.